Do you have any last words that you would leave us with, whether it's for practitioners or for patients to improve outcomes overall and work together?
Diabetes is changing and it's increasing, type 1 and type 2. And it's becoming something that everyone is having to take care of, even in primary care settings, whether you want to or not, because there's a lack of specialists across the US and across the globe. So I encourage really anyone to learn about just being able to detect and differentiate the difference between type 1 and type 2 and really acting early and not waiting for someone's hemoglobin A1C to be high, or maybe not waiting for symptoms to start. Like, really check the glucose. Check it. Get the autoantibody screening done. It's very easy. It's covered by insurance. Figure out what you're treating. And if you don't know, ask somebody else that does. Refer to an endocrinologist, a diabetologist, a CDCES, someone that can help the patient early on and act early rather than just waiting until something gets out of control. We find in diabetes, the earlier you act, the better the outcomes will be long term. And another thing that just came up that's very exciting in the GLP-1 community is that traditionally GLP-1s have been studied really just for people with type 2 diabetes or have obesity or weight loss issues. But we have been seeing a ton of progress in the type 1 space. In fact, there is the first and only clinical trial data that is going to be released today at 3:15 at the last day of the American Diabetes Association conference. It's the first clinical trial that is going to release data showing efficacy of GLP-1 therapy in patients living with type 1 diabetes. And this is really, really exciting for people that need it, because people with type 1 are deficient in the hormone insulin, but we also know that they need these GLP-1 receptor agonists to help decrease their insulin need and help them get better outcomes. So I'm really excited to see this. It's going to be presented with a few different really expert clinicians. One of those is Dr. Viral Shah, and I had a chance to talk to him before the conference, and I'm really excited to see those outcomes.
Well, this has been an amazing conversation. Thank you so much for joining us on MD Newsline.